Okay, hello everyone. My name is Andrew, and today I want to talk about Yamane technique. So if you guys want to see how I actually do the Yamane technique, how I actually insert the IOL without the capsule support, you can scroll down and find this video. I think it's the second video on the model. If you want to see the real case, it's I guess it's third one. But so today we're gonna talk about what instruments do you need to train your skills for implantation the IOL without the capsular support using the Yamane technique. I will show you my equipment, and so it may be some variations. So I think you type in the name Yamane technique and find my channel to tackle your complication during your phacoemulsification cases. I mean, I only started my cataract surgeries, but I already have some complication, and it's okay, I guess, to have a complication only on in your operation career, in surgeon career. But I want to be more confident in what I do, and I want to have a plan B if I get in some sort of complications. So this is why I think Yamane technique will allow me to not to be too afraid to do a mistake during my cases. Okay, so long story short, I will show you my equipment. Let's go. So, to train my Yamane technique, I'm using the Simuli iris prosthesis. Actually, it's not developed to do Yamane, to train Yamane technique, but I have this due to some previous training. Actually, you can get one on simuli.com, and it will cost you $95. But there is other Simuli device which was designed specifically for Yamane technique. They call it iris suturing and IOL fixation, and it will cost you it will cost you $75. Okay, so this is the model that I use. Great. So the next one, then OVDs. So you see it's Discovisc. So I use OVDs that are left from actual cases, and during the operation I'm using the Discovisc. So I'm using Discovisc from Alcon. Okay, it's visco-dispersive OVD. There you go. It looks like this. Great. So let's pass over to the blades. So for a main incision, I hope you see it. I use the Intrepid 2.2 incision blade, but I enlarge my incision a bit. So 2.2 blade from Alcon Intrepid. Then the paracentesis, I use 15 degrees 1.2 millimeters sharp point blade. Okay, sharp point blade for paracentesis. Great. Then Calliper. So it's really important to mark the points where the needle goes, and to mark those places I use a caliper. I use 2 millimeters to mark the points of needle insertion. Okay, so the next one, and it's really important, so I emphasize your attention on this one. Those are needles. Okay, so you need specific needles. I use 30 gauge needle, but those are thin wall needles. They're hypodermic needles. They use in dermatology. In Europe, because I'm working in Europe, so I get in from a TSK laboratory, and better see those specifications here. Should be in focus. Okay, so the main thing that those are thin wall needles. Okay, you see, because the haptics of the lens which you will implant, it should go into the needle without any problem, and the thin wall needles, they give you this opportunity. Okay, so you see how it looks like. Okay, thin wall needle. Okay, great. So for one case, and you will need actually 2 of those, and you can get it for Europe. It's 13 millimeters needle from TSK laboratory, and it will cost you 50 cents one needle. Okay, great. We need to pass over to the syringe. So those are my preference. You can use this tip or not, but to hold this needle and it gives me a better access to the point when I want to go with my needle into the eye. It is 2.5 millimeter syringe. It gives me better control when I'm going into the eye with the thin wall needle. Okay, now we need to pass over to IOL that I use. So there's a lot of recommendation from other surgeons. I will list them in the description below. I think so. But for training, I use the Alcon MA60BM with the 3-piece. This is 3-piece IOL. 3-piece IOL with the PMMA haptics. It's a non-sterile sample, and you can get it from Alcon representative. So I've talked to them, and it cost me nothing to get the samples to try, because there's no sterile. So this is how it looks, and this is why you need thin wall needle, because this haptic should go into the needle without any problem. Okay, so this is hydrophobic acrylic 3-piece IOL with PMMA haptics, and it is Alcon MA60BM. As I said, I will show you those instruments that I use for training. So there may be variations, and for example, for grasping the haptics, I use the Geuder intraocular IOL explantation instrument from Snyder and Osher. So this is how it looks like. You see that those sharp edges? Those sharp edges could give some problem during IOL insertion into the lumen of the thin ball needle, but for me it works fine. So on the YouTube, for example, you can type Brian Kims, so he's using other forceps. Okay. Then, what is really important for your training. So, to use your simuli couple of times and to save your money, you will have to explant the IOL. So if you have on your places scissors to cut the IOL that you've implanted, it will be great. So to explant the IOL that I've implanted into this simuli, I use the Snyder Osher Scissors, 2mm. They go to 2.0mm incision. So mainly I use them to reduce the simuli. Of course, you will need to have the injector to implant the IOL. So what I use, I'm using the Seiko Royal 3 injector with a Phi cartridge to implant the IOL. And also I'm using the Lumera 700 as my operating microscope, and Callisto system to record the video. So there are some devices that I didn't show, but during the real case you should have it. This is, for example, the low temperature cautery with a fine tip. You can order it from Acrylic. It's Bovie low temperature fine tip cautery. Well, it depends. I think I will use the anterior chamber maintainer to maintain the pressure in the eye. But if I will do the vitrectomy at first, which is advised, so then I will use the trocars, single-use trocars with the anterior vitrectome from a Centurion system from Alcon. So thanks for watching this video, and hope to see you on the next one.